Hey, it's Dr. White, and I'm back at the Dr. Whiteboard to talk a little bit more about macular degeneration. We spoke about the two different general types, dry versus wet. In wet there's bleeding, in dry there's not. Let's go a little bit deeper into dry macular degeneration. In dry macular degeneration, there's a problem typically with the barrier layer, the RPE, or retinal pigmented epithelium. And there are 3 or 4 or 5 different types depending on how we divide them up. I like to think of them like this. The first, and one of the most common, is dropout or atrophy. This is a thinning of the retinal pigmented epithelium. We get areas which just disappear or they become more thin. And when I look inside the eye, there's not the same uniformity of the color in the macula. It looks kind of moth-eaten. That's exactly what it looks like. The second type are hard drusen. Hard drusen are little tiny excrescences, we call them, of the RPE itself. To me, it almost looks like I'm looking down on something where we've dropped a bunch of tiny, tiny marbles or BBs onto the retina. They look white, they can have a pattern, they can come along with atrophy, or they can be standalone. The number of drusen correlates with the risk. The more drusen you have, the greater the risk of losing vision. The next are soft drusen, and these are the bad guys. These are the things that give us risk for bleeding. Soft drusen are actually areas where we have material underneath the RPE. And this is material that's typically removed from the eye, from the retina, kind of like waste material. Over the course of a lifetime, in some people, the waste material builds up, and it builds up underneath the RPE. The bigger the soft drusen, the greater the risk for bleeding. The bigger the soft drusen, the more we have decreased vision. We can also get something to the point where the RPE actually detaches from the underlying choroid because there's so much stuff in there. Sometimes it's fluid, sometimes it's this soft drusen material, the waste products from vision. Lastly, and this is really important, the bigger the soft drusen, the larger the area and the more central, the higher the risk we have for both decreased vision as well as bleeding. When we look inside the eye, we try to grade the risk of a patient. If you have high-risk drusen and high-risk macular degeneration, we will talk to you about the importance of preventative treatment to prevent you from going on to change from dry to wet. So I'll come back in a bit and we'll talk some more about different types of macular degeneration, what we do for prevention and what we do for treatment here at the Dr. Whiteboard. See you soon.